Welcome, everybody, to Understanding the Human Condition. I'm your host, Dr. James Flowers, and I am super excited today to have my new friend, Apro Choudhury, with us. Apro, how are you?
I'm doing good. I just celebrated a birthday yesterday, trying to stay cool.
Yeah.
Yeah.
Do you mind the number? What's the
Yeah,
number?
the number is 30. Yes, so officially an adult now. I can
Absolutely.
begin my
Yeah.
career.
Yeah. So, do you feel different at 30 years old versus 2 days ago?
It felt like a Tuesday, honestly.
Yeah.
I went to work. I got to work with a young girl at Texas Children's where
Mhm.
I'm a mind body interventionist. And, it was a lovely way to start the day with service.
Yeah.
And
Absolutely.
then I ended the day having a conversation with some folks in Uvalde, Texas, where I've been
Amazing.
working for the last year,
Yeah.
bringing mind body medicine, mind body practices to a small group of clinicians
Yes.
who are working and have been working
Kind
in
of
that community.
frontline
Yeah,
clinicians.
exactly.
Yeah. First responding. Yeah.
It's the backbone of primary care in that community.
Yeah,
And
absolutely.
yeah, so
Yeah, I
uh,
love it.
yeah, it was a day of service.
So you came in, I think that's an amazing way to celebrate any birthday,
Yeah,
number 1,
yeah.
but your 30th birthday is a big deal.
Hmm.
I still remember my 30th birthday.
Hmm. Yeah, yeah.
And you will always remember your 30th birthday, and you get to say you did it with service. That's really super cool. So you came in to J. Flowers Health Institute a few weeks ago just to
Hmm.
do a tour because you were intrigued and you wanted to know a little bit about what you're doing or what we're doing.
Hmm.
And you told us about your career at Texas Children's Hospital, which I'm blown away by. At 30 years old, you've done all the things that you've done, and we invited you back for this podcast. So I want to read for our audience just, APRO is a mind body interventionist focusing on integrative behavioral health consultancy and public health with 6 years of experience empowering traumatized clinical populations, whole communities, and healthcare institutions. He's really very skilled at building relationship driven partnerships that activate our capacity to heal trauma, understand ourselves, and face challenges with practical and accessible mind body skills, which is the backbone of my philosophy as well. Right.
Hmm.
And you just mentioned Uvalde. And I just saw that one of the moms that is traumatized from her daughter, I think, being killed that day is running for mayor, and you're doing so much work there, and
Hmm.
she's trying to create change in the
Yeah,
city as well, and really in the world. So tell us a little bit about your work in Uvalde and what you've been doing.
yeah. So, first of all, I have to start with just a moment to honor the community in Uvalde and give thanks and gratitude for their trust. And so much of the work and any of the work that we do through the Center for Mind Body Medicine when we work with communities that have been traumatized is that building trust and getting to know each other, just like we're getting to do
Yeah.
now, right? And I can imagine it's very similar in certain ways to the work that you get to do at J Flowers in getting to know your clients and their families. And so that's what we did over the first years, really getting to know these folks and hearing their stories and coming from a place of invitation. Like, this is what we have to offer. This is the work that we've done, and this is the way we've worked with whole communities before. And it's been a gentle process of introducing what mind body medicine is and showing how we can practically integrate mind body medicine into what we're already doing. So it's not saying that you forget about everything you've learned, forget about your education or how you work with patients. It's not that. It's what you're already doing and then finding moments of ease, finding a moment of connection with yourself, with how you're feeling. A lot of it has been connecting with uneasiness, with discomfort. And so a lot of this work has been around giving people tools, simple tools that they then get to decide how they bring it into their life, whether it's in the clinic, at home with their kids. And so the over the last year, we've really built up a strong foundation of understanding. And now this fall, we're going to get to go back and do some workshops. And then in the winter, we'll do a kind of intensive 5-day training
Amazing.
with about 100 people there. and they'll get to really experience a small group model, practice
Mhm.
skills, learn a lot, and then they're positioned to then lead the work in the community from people who are already committed, who are already natural leaders, who are already, amazing clinicians,
Mhm.
then get to decide what this looks like.
What an amazing service opportunity. How did you decide that that was going to be one of your really service-oriented activities?
Well, all of that work kind of happened on accident.
Mhm.
And it's let's rewind back to
Mhm.
2017,
Mhm.
back here in
Mhm.
Houston after Harvey.
Yeah.
And at that time, I was convinced that I was going to go to medical school.
Mhm.
So Harvey happens, and then there's this kind of a call to join this psychosocial disaster response. And
Mhm.
I, told myself, this is going to look really good on my med school application. you
Absolutely.
know,
They're gonna see that I go out and do community
yeah,
service and yeah.
yeah. And I sit in this training, and it's the work that we're now doing in Uvalde. It's coming together, sharing what needs to be
Mhm.
shared. No one's diagnosing you, no one's trying to fix you. We're coming together as humans, and we're teaching skills that help us connect more deeply to what's happening in that moment, right? And that's a lot of what mind body medicine is.
Sure.
And so that experience kind of cracked me open in the best way possible. And needless to say, I never went to med school, and
You
this
found
really
your calling.
yeah,
Yeah.
yeah, and I'm lucky.
Yeah, you are. Absolutely. I wish I had known you back then and introduced you to my niece, Marie Earthman, because even today she's traumatized from
Mhm,
Harvey. She and her husband and children live, or one child at that time, live about 4 or 5 blocks from Breeze Bayou. And
mhm.
she was a little over 8.5 months pregnant when
Goodness.
Harvey hit. And
Yeah,
then, the flood came and they walked out of their house in the middle of the night and the water was just at the top of the stairs.
yeah,
And her house was 5 or 6 feet off the ground, right?
yeah,
And then water was coming up to the top of the stairs and there was no one around to help, not
right,
at all.
right.
And she, to this day, is still feels trauma in a pretty bad, heavy rainstorm.
Yeah,
They moved into a penthouse of a high rise. They
right,
sold their
right,
house, and
yeah,
literally, she chose the penthouse because she knew it wouldn't flood or felt
right,
like it wouldn't flood.
right.
And she ultimately did some trauma work and some work around that. But,
Mm,
just think of the millions of people in Houston
mm,
that were traumatized from that flood that still experience that. So
right,
that's pretty amazing that that was what sparked your interest
yeah,
in doing this line of work.
yeah, and, those floods still live on in the collective consciousness and
Mm.
unconscious kind of field
Yeah.
within Houston.
Mhm.
And there's many different kinds of traumas
Mhm.
that live on and are just below the surface or impacting us. And so this work, when we start connecting to what's going on, how we're feeling, what is the message that our body is trying to communicate to us, that, as we get more familiar with that
Mhm.
process, it pays incredible dividends to any kind of therapeutic work that you might be
Mhm.
doing. And so that's why this has been so easy and so sensible to integrate into the kind of work that we might do
That's
and
right.
as behavioralists and
Mhm.
clinicians.
That's
So
right.
so yeah.
Absolutely. And then you put into that a pregnant female, right?
Yeah.
And guess what? That trauma can pass down to the child as well, the unborn child,
Yeah.
because her nervous system was responding so severely to that flood that generational trauma occurs even through an
Right.
event like that.
Absolutely. And that's, really the work that Rachel Yehuda and Felidi kind of pioneered, looking at what is actually happening on a cellular, a genetic
Yes.
level,
Mhm.
and how are these wounds that happen within our
Mhm.
lifetimes carried on,
That's right.
and whether our lineage knows about it or not.
Mhm.
And that's a whole other story. It,
Exactly. We
it,
could do a whole 5 hours on
yeah,
that or
yeah.
more. Yeah.
But it's real. And so this wisdom, and you might be familiar with it, kind of comes from the indigenous
Mhm.
traditions. And it points to when we do healing work, we're impacting 7 generations behind us and 7 generations ahead of us.
Yeah.
And it kind of makes me really think about what are the conditions necessary for
Mhm.
us to be able to do that kind of work? And what can we as clinicians do to support somebody's journey. And so mind body medicine is just one part of the
Sure.
the wide range of things that we need to attend to when we're working with people or whole communities.
Absolutely.
Yeah.
Talk a little bit more about I was literally just talking about this yesterday with my niece and the 7 generations behind us, right? And,
Yeah.
we both come from a very traumatized family, a very traumatized background, and the amount of trauma that goes back generation
Mhm,
after generation and how that affects the next 7 to 10 generations.
mhm.
Talk a little bit more about your understanding of that generations prior to us and the generations after.
Absolutely. Well, I don't know if we have enough time to do a comprehensive history of all
Yeah,
the ways
exactly.
humans have been
Mm,
traumatized. I think there's plenty going on right now for us
mhm,
to just get a sense of how we might be impacted
mhm.
just right now, and to think back to all the past suffering, the wars that are continuing, and kind of, as I think about it from a macro perspective, it's those past sufferings and those past traumas and the fact that they have not been resolved is why certain things are kind of continuing and why we're seeing these cycles and seeing these things that are happening, day to day
Mhm,
amongst within families or within communities are happening
mhm.
on a global
On a
scale too.
global scale, exactly.
And so how that impacts us into the future when it comes to our health, it's very clear that there are serious epigenetic concerns when trauma happens. And this can exacerbate, conditions that you're predisposed to.
Mhm,
So, one way to think about this is that there is traumatic stress. And traumatic stress, when that happens, it kind of sets off a cascade of different functions within the body that are actually natural and adaptive and protective. And many of these functions are inflammatory in nature. Right. So what we're really looking at is stress or trauma
mhm.
leading to inflammation. And then that inflammation kind of creates a condition within the body that makes us more susceptible to any kind of disease, any kind
Absolutely.
of environmental
Yeah,
influence. Our diet becomes more affected. So, really looking at this from a kind of a whole person, whole human
yeah.
perspective. And so, these things also create so that's what's happening physiologically. And then interestingly, biobehaviorally, right? Looking at how we navigate
Mhm.
through the world and how it's talking about personal philosophy, how we are making the most and doing the best with what we have, right? So a lot of what we're inheriting, for example, this trauma, preconditions us to operating within certain kinds of patterns of behavior,
Absolutely.
which sometimes get pathologized. Sometimes we can operate with those patterns of behaviors functionally, and we don't need a diagnosis or we don't meet the conditions for a diagnosis. But those patterns of behavior may still be causing harm, may still be leading to impacts within us or around us, within our families, within our work, that might need to be examined.
Absolutely. The way in which we interact with others throughout the day,
Mhm.
whether it's with our patients and what our patients tell us,
Right.
whether it's with our families when we go home, whether it's really with anyone, right?
Mhm.
It's in our subconscious, it's in our tissue,
Right.
it's in our, as you said, it's at the cellular level.
Right.
And learning how to work with that and
Mhm.
understand it is a process.
Yes, and it's a practice.
It is a practice. That's a much better word than a process. It is an ongoing practice
It is.
of really understanding what is in our subconscious mind and how it affects every movement and thought we have throughout the day.
So what's in our subconscious mind and then what's living in our cells
Mhm.
and how that also is signaling to us, is sending messages. And that's a lot of what mind body medicine allows us to look at and interact with is this process that's already happened,
Right.
right? So now we get to engage with it. And when we engage with it, we are able to become more regulated physiologically,
Mhm.
psychologically become more regulated. In plain speak, what more regulated means is we feel better.
That's right. Yeah.
And feeling better is really important for doing anything.
We hope that's the ultimate goal.
Yes. Yeah.
That's right.
Yeah. And it
And
helps us understand what we need to understand
yes.
when we're feeling better. And
Yeah.
so a lot of that work is about getting people to install those programs so that they can do it for themselves. Right. And so we're uninstalling viruses
Mhm.
and installing new healthy programs, new ways of thinking, new ways of navigating reality, literally training your mind and implementing these fundamental principles of neuroplasticity. And so that's kind of what the hope is.
I was just reading before you came in that, we have more than 100 billion neurons in the adult human brain. And we have the power to retrain those neurons.
Right.
And it goes from everything from chronic pain
Yeah.
syndrome, false signals of pain. It goes to our depression. It goes
Mhm.
to our really dreams and what we want to do in our life and believing that we can change negative into a positive
Yeah.
and
Yeah.
achieving whatever it is that we want in life.
Right.
Yeah.
Right. Right. And what's so fascinating about mindfulness as a tool that we can implement into our daily life, into our healing journey, and what makes mindfulness different than relaxation or
Mhm.
hypnosis or acupuncture is that mindfulness is actually, and we've been able to look at this through very recent advanced neuroimaging technologies, fMRI based
Mhm.
technologies. And this is research, if anybody's interested, this is research coming out of the Zidan lab, UCSF. Fadl's a good friend, and he's an eminent neuroscientist, chronic pain researcher
Sure. That's
in the
right.
Department of
Yeah.
Anesthesiology there. And so some of this research is pointing to how mindfulness actually operates on a part of the brain, which is the hypothalamus. And this is a part of the brain that essentially connects the external world, so what we're perceiving through all our senses, and it connects that to our sense of self.
That's right.
So me, James, Afro.
Mhm.
And so that bridge is what is being impacted when we practice mindfulness. And what it's actually doing is it's kind of turning down the volume of the signal of the hypothalamus.
Right.
And
Yeah.
it's diminishing our ability to engage in self referential
Mhm.
processes. So we're less able to identify with our meanness.
Right.
And I'll just leave it at that and kind of, I'm curious to hear what you think about that.
I live it the same way you do every single day,
Yeah.
and my background and training is in chronic pain, really
Hmm.
working with complex individuals who have chronic disease
Yeah.
processes and chronic pain. And it's part of what we teach here
Yeah.
every day to our patients. And it's
Hmm.
part of at the cellular level
Hmm.
and what I believe. And, mine goes from looking at the gate control theory of pain from Melzack and Wall at the University of Washington to his research at
Yeah.
ESF,
Yeah.
and really looking at the work, the same similar work
Yeah.
they're doing really at Stanford
Hmm.
University.
Hmm.
And it's amazing
Yeah.
that back in 1962,
Hmm.
that this was just coming out in the early 60s when Melzack and Wall started talking about the gate control theory of pain. And then it just continued to evolve into neuroplasticity and everything that we're talking about today.
Yeah.
So I could talk about this. We could sit here all day long and
Yeah.
continue to do this. I want to know before we have to go,
Sure.
I want to know what you're doing with this amazing knowledge that you have, this incredible depth of knowledge and
Yeah.
mind body work. What are you doing with this with children and
Mm.
families
Mhm.
at Texas Children's Hospital?
Yeah. So we still talk about the neuroscience, and we talk about it in a way that makes sense for the kids and their
Yeah.
families. I think working with kids and families is such a privilege because you get to work with a complete system. And so much of what happens in general in working with pediatric populations is that the child or the adolescent might think that they are responsible for the challenges that they're
Mhm.
facing. And that creates a whole other complex
Yeah.
shame,
Mhm.
guilt that complicates healing process, understanding. And so when we have the families involved And when we're teaching them these skills that help them find peace or a moment of ease when tensions are rising or
Yeah.
some there's a disagreement, like siblings, we get to practice these skills. And then we've heard from families that the child will tell the parents, "Hey, mommy, I think it's time to take a breath."
Absolutely.
Right? And
Yeah.
vice versa. And so working with the whole family or a caregiver
Mhm.
or anybody there who's
True.
able to support and,
Yeah. Yeah.
invested in supporting that child
Yeah.
is such a pleasure. And that's what we do. It's much of what we discussed, but it's fun.
Yes.
We have a lot of play involved and
Absolutely.
really emphasizing this idea that these skills that we're teaching you to regulate yourself, the effect is often amplified and more enjoyable when it's shared.
Yeah.
So
Absolutely.
co-regulation,
Yes.
really, how can we distribute the burden or the pressure or the challenge amongst
Mhm.
others and share it
Yeah.
and kind of rely on this ancient technology of connection and being social beings.
Absolutely. I
Yeah.
remember I'm sitting here listening to you, thinking about the work that you're doing with children, and I was reflecting of my first experience of this, of really mind body work.
Yeah.
And it was in 1976. My father had just died. He had a heart attack in front of me and died.
Yeah.
And
Gosh.
so that's
Yeah.
traumatized, right? To any 10-year-old. And so, of course, my mother finds a great therapist, and I remember her so well. And I entered this group therapy program for young boys who were going through trauma. We were all the same age, and we would lay on the floor, and she would walk us through these breathing techniques and these
Wow.
mind body techniques back in the early 70s when I was 10 years old. And I think that every day about that experience and how it sparked my initial interest in doing this and continuing that research and that
Yeah.
with my patients today. So I think you're making an absolutely immeasurable impact on the children and the lives that you're touching both at Texas Children, really around the world, and also in Uvalde, where you're doing so much of the work with traumatized, really the city and the state of Texas. So I appreciate you so much for what you do. And I look up to you, and I think that I would love to spend more time visiting and have you back. Maybe we need to do a series of podcasts on those. But thank you for coming
Yeah.
in. I really, really appreciate you today.
Yeah, thank you, Dr. Flowers, for having me. And I look forward to our kind of ongoing the dance, right?
You
You,
bet.
you, you never know what's going to come. And so we've begun
Yes,
and let's see where
absolutely.
we go.
I
Yeah.
think a new journey is beginning.
Yeah.
And if you guys want to learn more about neuroplasticity and trauma work, please reach out to us at J Flowers Health Institute. You can find us at jflowershealth.com. Thanks and have a wonderful day. And thank you again.
Thank you. Take care.